We'll go ahead and get started. Well, hi, everyone. Thank you for joining us tonight for this conversation on the Spina Bifida Association's plans to build a better, brighter future for people living with spina bifida. I'm Mike Wood, SBA's Chief Operating Officer, and I'm joined by Dr. Brad Dicianno, SBA's Associate Medical Director. Dr. Dicianno is a physiatrist. He's also a bioengineer, and he wears a number of hats in addition to his duties here with SBA, including being a professor and endowed research chair in the Department of Physical Medicine and Rehabilitation at the University of Pittsburgh School of Medicine, medical director and COO of the Human Engineering Research Laboratories, and director of both the University of Pittsburgh's Center for Assistive Technology and the Adult Spina Bifida Clinic. As many of you all, I'm sure, are aware, SBA is celebrating its 50th anniversary, which I'm very excited about. It's become really a time for us to reflect and celebrate the strides that we've all made together in improving health outcomes for the 166,000 Americans living with spina bifida. Yet at the same time, I think it's important to note that while we are in a better place today than certainly we were in 1973 when local spina bifida groups came together to create this national organization, we all know that we have so much more work to do. And that's really the focus of the presentation that we're going to go through today. It's really to share with you the plans that we've developed along with our partners, with local SBA chapters, and with members of our community to continue building on the progress we've made and over time to get to a point where every person with spina bifida in this country has the support they need, beginning at the time of diagnosis through adulthood, and that no one has to go without access to quality, affordable health care. Our belief at SBA is really simple. Everyone has the right to this kind of care, and it is absolutely immoral and totally unacceptable that they don't. That has to change, and we really feel strongly that together we can create that change, and that's really what we're going to talk about tonight. In working with our community to develop our new strategic priorities over the next few years, we recognize that while there are definitely health challenges all across the lifespan, there are two particular points that really require focused attention and effort. One is the period from diagnosis through the first few months of life. And then the other is the period of transition from pediatric to adult care and throughout adulthood. So while we'll continue to partner with organizations and support efforts to address other areas and challenges that people with spina bifida face, we're really putting a strong stake in the ground around addressing healthcare needs at these points, because no other organization is addressing them, and the need is really too great to ignore. So while these challenges are big, we know that, and they won't be solved overnight, over the next few years, we're going to work on rallying human and financial resources to make sure that expectant parents of babies with spina bifida receive an accurate and complete diagnosis and understand the full potential and possibilities if that child is born and nurtured into an adult, and that the newborn and the family are connected to a high-quality pediatric spina bifida clinic within the first 3 months of life. And B, we're going to make sure that every child with spina bifida aging out of pediatric care has a smooth transition to high-quality adult spina bifida care and can afford the equipment, the medication, and the supplies they need through adulthood. In other words, just to make a long story short, we have to make sure that we eliminate the adult care cliff that exists today for far too many people with spina bifida. As I've said, and I'll continue to point out, these are really complex challenges, but they're not unsolvable. The reality, though, is that there's no silver bullet solution, unfortunately. I really wish there were. It would make things a lot easier for all of us. But it's going to take a collection of tactics to get the job done, and it's going to require us to not only meet people where they are and do more to address their immediate needs, but to do what I call swimming upstream, where we really address the root causes of these problems. We know that it's going to require additional data that's currently lacking. It's going to require research that can only be achieved with that right data available. So those things really work together. It's going to take changes to public policy. It's going to take increasing public awareness and educating people, the right people who are currently uninformed about the things that they need to know. We're going to have to create new training, which I'll talk about more in a little bit in this presentation. And finally, we know we have to do more to connect people with the support that's available through our information and referral services. Each of these tactics is a piece of the puzzle. And I think it's really important to note that if you remove one of these pieces, the puzzle is really incomplete. And so it's going to take all of these efforts working together over time to really get the result that we want. So I want to turn our attention, if you will, to the beginning of the lifespan. As I mentioned, our goals are first to make sure that we improve the diagnosis experience so that it's accurate, so that it doesn't create unnecessary trauma for families, and that it sets expectant parents and their baby up for maximum success. And second, we want to make sure that those babies are connected to a high quality spina bifida clinic by 3 months of age. We know from our own research, and frankly, from talking to countless parents in our community, that OBGYNs are delivering the diagnosis of spina bifida inaccurately, and it's essentially being positioned as the death sentence, and that families aren't getting an accurate picture of the possibilities and the quality of life their baby could lead. Nicole and Charles Clegg, who you see here, are parents that went through this experience. Nicole was pregnant with twins, and she found out that one of them had spina bifida. They really wanted to start a family, and they had gone through fertility treatments for 3 years before finding out that Nicole was pregnant. So it was very exciting, and they were pregnant with twins. But what really should have been a really exciting and joyful occasion for them at their 19-week ultrasound was really marred by the realization that what they called baby A at the time had spina bifida. And instead of really learning about the options and getting an accurate picture of what life could be like if she chose to continue her pregnancy, she heard phrases like mentally different, severely delayed, dependent with a ventilator, probably, and never. And you can see from the quote what it did to Nicole and how it impacted her throughout her pregnancy and even when her children were born. She said, "There was a stigma placed on me that day. I've never been able to let go of it. I was made to believe the only reason why babies are born with a neural tube defect was from something I did wrong." And I've been here at Spina Bifida Association for 2 years now, and I can't tell you the number of parents who told me similar stories. We have to do more. We have to do more to equip doctors with the right information so that they can do a better job painting a more accurate picture of life with spina bifida. No one should have to go through what the Cleggs and many other families like the Cleggs have experienced. It's just totally unacceptable. So the real question is, how are we going to do that? How are we going to change this experience for people? First, we already, and I want to let you know that some of these things in the presentation that we'll talk about are things that we're planning to do once we secure funding and resources to do them. But there are many things that are in this plan that we're already undertaking. One of them is that we're already working on new tools through a partnership with an organization called Lettercase that will be distributing to doctors who deliver the spina bifida diagnosis to equip them with the right information. Part of that work is going to be a really robust outreach and educational awareness effort. So we'll be working with them. They have a huge network of OBGYNs and other doctors that they work with to be distributing those tools and getting those out. We're working on those right now. We hope to have those done very soon. We have drafts in progress, and we're going to be getting those out to people next year. Another thing we're doing is that we're launching an expectant parent group. It's going to be led by Colleen Payne. She's a parent of a young adult with spina bifida, a volunteer. She's a part-time contractor with SBA as well. We want to make sure that expectant parents can support one another through this process, and we want to make sure that they can draw on the experiences of other parents who have had children with spina bifida and have gone through this progress. So we're working to launch that. More information on that will be coming out. You all should sign up. If you aren't already, you should sign up for our newsletter. You can do that by going to spinabifidassociation.org and scrolling to the bottom of the page with a sign up form. But we'll be launching that, and we want to make sure that anyone that we know who's an expectant parent of a baby with spina bifida has access to that support group. We're also going to be training more clinicians in treating spina bifida, which I'll share more about shortly. That effort is going to be focused primarily on adult spina bifida clinicians, but we're also going to be reaching out to more pediatric spina bifida clinicians and growing our lists of known pediatric spina bifida doctors. We want to do that because we want to improve our ability to connect people to those doctors through the National Resource Center, our information and referral service. Our goal with all of this is to work to make sure that, again, that all babies with spina bifida get off to a strong, healthy start and that families are set up for success. While we know that all of that is really important, and we've got to improve the diagnosis process, and we do have to make sure that babies get connected to those spina bifida clinics, we know that's not enough. And it's clear, again, from our own work and from many, many conversations we've had with our community that we have to do more to address the care cliff that exists when young people transition out of pediatric care into adulthood. We have to do more not only to address that transitional challenge, but to address the numerous care gaps that exist for adults that are living with spina bifida. Our goals here are really clear. They're not simple, but I do believe they're achievable. I absolutely believe they're achievable. Over the next few years, however long it takes, we're going to do what it takes to make sure that all adults with spina bifida have access to high quality, affordable clinical care, along with the equipment, supplies, and medication they need. The CDC's National Center for Birth Defects and Developmental Disabilities, which manages the CDC Spina Bifida program, they recently worked with Epic Research on a study where they queried their database of over 250 million patients. So this is a huge database. And one of the things they found I think shows both promise and frankly highlights the enormous amount of progress we still need to make. First, I'll give you the good news. Their data shows that spina bifida patients are living 15 years longer in 2022 than they were in 2011. And it's definitely something we all should celebrate. I'm very excited about that. But there's also bad news. It also shows that adults with spina bifida are dying 34 years younger than their non-spina bifida counterparts. Maybe this goes without saying, but that is absolutely unacceptable. And yet, at the same time, it really shouldn't be surprising given what we know about the state of adult spina bifida healthcare in this country. We know that of the 166,000 people living with spina bifida, about 2/3 of those are adults. We know that there are about 100 pediatric spina bifida clinics around the country, but there are only about 30 adult spina bifida clinics, not even one for every state in this country. We know that spina bifida is still taught primarily as a pediatric condition. So all of those things impact the access of care for adults with spina bifida. Care for people with spina bifida, particularly adults, again, is not affordable for so many. It costs over $1 million over a lifetime in treatments for adults with spina bifida. The out-of-pocket costs are just way too high. We've seen that across not only the actual clinical care that adults need, but their medication, their supplies. Insurance isn't covering the things that they need. It's a huge challenge. And on top of that, the quality of the care is highly uneven. The Spina Bifida Association created the first ever guidelines for the care of people with spina bifida. Those didn't exist before. We worked with clinicians and people with spina bifida and others in the community to create those. And those care guidelines are changing the face of clinical care for people with spina bifida across the country. Those guidelines were crowdsourced with knowledge and expertise from people who treat adults with spina bifida and children with spina bifida. What we need to do now is make sure that they're fully informed by quality research into the issues that people with spina bifida face. There are still huge research gaps. We've created a community-centered research agenda that we're pursuing, but we still have to find funding for that research. Additionally, there are huge data gaps, and the future of healthcare research is really around mining and looking at healthcare patient data. We have a CDC spina bifida registry that we were instrumental, and many of you were instrumental in helping to create by pushing for for funding for that at the national level. The CDC manages that registry. But right now, there are only 11,000 patients in the registry. There's only $7.5 million a year spent on the entire CDC program, which is just a drop in the bucket. It's a rounding error in the federal budget. So we have to get more patients in that registry. And again, we have to make sure that the care standards that we have created are continually improved and informed by research, and that those standards are implemented across the healthcare community. So we have a plan on the books that, again, with the proper funding and with the right support, will ensure that every adult with spina bifida in every state has access to adult spina bifida care. Again, there's mixed news on this front. This slide, I don't take the dots on this slide as literal. It's meant to be a graphic representation of sort of what we hope to achieve. We do, however, currently have a number of high quality multidisciplinary adult clinics around the country. We're calling them spina bifida super centers, for lack of a better term. I mean, some of them are represented on this map, and those are places that exist. So I want you to look at this as something we can build toward, but some of this infrastructure already exists, so it's not like we have to build it from the ground up. It's something that's definitely achievable. Our goal is to first, in building this, is to first access a data that's available and out there. Some of it costs money to invest in, but we want to get access to that data so that we can account for the quality spina bifida care that already exists out there. We want to account for it, map it, and make that information available to all of you. So that's really the first step in the process. The second step is then we have to fill in the gaps. And what we want to do is make sure that, again, that there's at least one place in every state, hopefully more, where people can get spina bifida care, where adults can get spina bifida care. And we want to network those locations with these super centers so that they can draw on the multidisciplinary expertise that's available when they need it. So again, the question is, how are we going to do this? We're really, and we've sort of framed the presentation around these three areas. We're going to focus on three really important areas. So again, one is access. We actually want to grow the number of doctors who know how to treat spina bifida, because we know that there's not enough right now, and there's especially not enough who treat adults with spina bifida. We want to improve the affordability, so we've got to address affordability. We have to lower the out-of-pocket costs for spina bifida treatment, for medication and for equipment. The third piece of this is really quality. We want to enhance the quality of spina bifida care by better understanding how to treat people with spina bifida, and again, by standardizing that care so that the care is high quality everywhere. Let's talk a little bit about access first. We're going to address the access issue in a number of ways. One is that, and I mentioned this earlier, that I wanted to talk a little bit about training. We want to launch Spina Bifida 101 training, and we've already made a down payment on this. We had a program called Project Echo that we hosted this year that was sort of an initial model for how we could train clinicians in treating people with spina bifida. There was a lot of success with that. We got a lot of great feedback, and our plan is to take what we've learned from that and develop a new set of training programs. So this will be a series of training programs on treating adults with spina bifida. It will include asynchronous training. So think of that as sort of the kind of training where a clinician might pay in and be able to sit down online and take training and get continuing medical education credit for that. It'll include synchronous training, so people coming together online where they're live with a trainer. We're also going to create training modules that we can take to hospitals, to clinics, and also to medical conferences so that we can train people en masse. And we want to set this training up again so that clinicians can get continuing medical education credit for that work that they do and the training that they sit through. So again, we've made a down payment on this. The goal now is to generate the funding and the resources and to take what we've learned and start to package it in ways that it can be delivered at a larger scale than it has been. The second piece of this is we want to make sure that doctors out there, especially, for example, if you're going to a family doctor or a general practitioner and they're not as familiar with treating adults with spina bifida, we want to make sure that they have access to clinicians who do have experience in treating people with spina bifida. So our plan is to launch a clinician-to-clinician helpline. So this is something that will be an addition to our National Resource Center. It's the National Resource Center is a place that many of you are familiar with, where you can call and get connected to resources and support. We want to create a clinician-to-clinician component to that resource center. So doctors can actually either call or email, and they can schedule a time to do a consult with a clinician who has expertise in treating people with spina bifida. So again, we want to make sure that even if you're seeing a family doctor or a general practitioner who doesn't have that level of expertise, that they at least have the ability to do a consult with a doctor who does have that expertise, so that they can do a better job of coordinating your care. The other piece of this, again, is affordability. We know that if you have access to care and there's care available, but you can't afford it, it really doesn't do you very much good. So we have to work on affordability as well. We're going to address that in a couple of ways. The biggest way that we're going to address affordability is through addressing public policy issues. We're actually doing that already, and we hope to continue to do even more of it over time. So we've got to get insurance reform. Just to give you a couple of examples of how we've done that. One is we are working right now with policymakers and regulatory agencies on getting transanal irrigation covered. We know that neurogenic bowel is a huge challenge for many adults with spina bifida. We know that TAI, transanal irrigation, can be a game changer and can be the difference between being able to work, being able to do the things that you want to do and not being able to do them, being independent or not being independent. And so it's classified right now as an enema. So insurance mostly doesn't cover it. Now, Medicare and Medicaid definitely don't cover it, and most private insurances don't cover it. And that's unacceptable to us. We have worked behind the scenes. It's often done quietly, but every week we're approached to send out letters to insurers, pushing them to cover this. We had some success recently, and we were able to get United Healthcare to agree to start covering this. It's a very large healthcare provider, so that's a big success. But we're not satisfied. We're not going to be satisfied until every insurance company covers this, and Medicaid and Medicare as well. So we are actually right now, we have, and maybe some of you have seen this, we have launched a survey to find out more information about what experiences people have had in using TAI, what benefits they've seen from it. And we're going to collect that data. We're working with companies who develop this treatment, and we're going to be pulling that data together and then using it to go to the Centers for Medicare and Medicaid and push for them to make these changes in how TAI is classified. We feel like we have a good chance of getting success there. We've talked with people on Capitol Hill, and they've said that our first stop in making this change should be to approach the regulatory agencies and try to get the change. What we do know is that if Medicare and Medicaid start covering this, it often creates a snowball effect where private insurers will start covering it. We will, however, if that doesn't work, we do plan to go back to Congress and ask for a legislative fix. So we're doing that around transanal irrigation. We've also done similar research around catheters and the challenges people have had in getting insurance to cover catheters. It's totally unacceptable that there are some people who are paying $1,500 a year just to have to go to the bathroom. We've got to change that. And so we're going to double down our efforts over the next few years to continue to push for insurance reform so that medical devices and treatments are covered and covered in a way that the people can actually afford them. The other thing is that we have to educate people about this challenge. We know that there are not enough policymakers, there are not enough people in positions of influence who understand the challenges, and so that's why the research that we do is also important, because it's an opportunity for us to educate the public and the people who need to know this, for them to see what the challenges are and to recognize that people are having to pay these massive out-of-pocket expenses for basic treatments and supplies that anyone should have access to. That can be the difference between being dependent on help and support, or being totally independent. So we want to change that. The third piece of this is again, it's around quality. So the buzzwords here are access, affordability, and quality. It's great if we can create more access to care, if we can lower the cost so that people can actually take advantage of the care. But again, that's not good enough if the care is not consistently high quality. And so we have to make sure that the care that adults with spina bifida are getting is consistently high quality. And the way we're going to do that is through improving availability of research and data, and using and leveraging that data to improve the care standards and to roll them out in a more robust way, so that we can raise the bar on what quality care looks like. We know there's not enough data available, so we have to grow that. We're going to grow it by advocating for additional funding of the CDC patient registry, but also by developing our own registry, which Dr. Dicianno will talk about in a minute. And then secondly, we've got to advance the community-centered research agenda. It's focused around 6 areas. We call it community center because the agenda was really developed with the spina bifida community, which I think is really important, because the patient's voice needs to be part of figuring out these challenges. The opportunity now that we have the research areas and we have the questions developed is to start finding researchers and more researchers who are interested in researching those questions, and to be a broker and connect them with funding and opportunities to conduct that research. So let me turn it over to Dr. Dicianno so that he can talk a little bit more about what we plan to do in terms of both increasing the availability of data and advancing our research.
Thanks, Mike. So SBA is very committed to generating data and making more data available. And this data is really important for understanding the challenges, especially adults with spina bifida face over their lifespans. And also, the data helps us understand what treatments work and how to develop new treatments that are more effective. And there's several ways that we can grow our data. One is by developing a patient-reported outcomes registry. Patient-reported outcomes are measures that are reported by patients who are receiving care, information that we get directly from you as a community. This is a way that we can capture the voice of the community and the lived experiences of people in the community in a way that our existing National Spina Bifida Registry can't do. So that's really important for understanding function, quality of life, pain, just the experiences of people as a result of having spina bifida over their lifetime. A second way that we can generate data is by advocating to secure more funding for our existing spina bifida patient registry. We can do a lot more with that registry if we had more funding. And third, SBA will partner with clinics directly to collect patient data. An example of the way that we're doing that is by looking at clinics that have really good outcomes. There's clinics across the country that have excellent outcomes with bowel management, for example. And what SBA is doing is partnering with those clinics to really study them and understand what they're doing differently, so that we can learn from that and inform other clinics so that they can have similar outcomes. And next slide. And another thing that we want to do is partner with clinicians and people with spina bifida to advance the community-centered research agenda. The community-centered research agenda, like Mike said, was one that grew from our guidelines for the care of people with spina bifida. When we developed the guidelines, we identified a lot of research gaps. In fact, there were more than 250 gaps that we noted where we need more research And we needed to decide where to start. So we took that to the community and had the community decide what are priorities for them. And so now we have a more focused community-centered agenda to work on so that we can start with research in these areas. Some ways that we're doing that. So we'll further develop those critical research questions by making them more specific, ways that we can apply for grants, match them to funding opportunities that exist to be able to answer those questions through more research. Another is to get the research agenda out there to research audiences. There are researchers out there who want to do research, who want to partner with our clinics, and but they don't know what to study. And so this research agenda will help them focus their work so that they can apply for grants and get funding. And finally is just to make those connections, connect researchers interested in making those, addressing those questions to funding opportunities and clinics. And an example of what we've done in that area is at the last World Congress, we had networking events where people who were interested in certain research topics got together, formed teams, and actually applied for grants in some of the areas where the community-centered research agenda was focused. So those are just a few examples, but we have lots of ideas of ways to generate research moving forward.
Right. Thanks, Brad. So this is really just sort of a summary slide. We're going to make this presentation available, and I wanted to make sure that you all had a slide that sort of encapsulated what it is we plan to do and hope to do for adults with spina bifida. So with that, I think what we'll do now is I want to make sure that we get a chance to answer as many questions as possible. So I think we'll go ahead and take some questions. So let me.
Mike, one question is, are you reaching out to adults with spina bifida who have a professional interest in scientific research so that you may have the community input, but also help those adults with SB gain job skills for a better life?
So is the question is, are we engaging them in the research itself?
Yes.
Yeah, I don't. Brad, is that something? I know it's something we can definitely look into. I don't know if we have done that exclusively yet.
Yeah, I mean, I think we have started to do that. So at some of the groups that we've formed around some of these research topics include adults with spina bifida who've helped work on some of these research ideas and help us submit grants. There are a lot of funding opportunities out there for stakeholder-driven research, and stakeholder-driven research is just a good idea, right? You want the research ideas and the teams to be built around people with those lived experiences. And so we have and will continue to include people with spina bifida, also caregivers, in our efforts to apply for grants and form teams. And I also think it's a good point that the attendee made about, that also helps develop skills of adults, people who want to go into research, who want to go into science, can learn skills through that process.
Yeah, I would say if anyone knows of anyone who is a researcher, an adult with spina bifida, or is interested in participating in supporting research in any of this, reach out to us and let us know. Absolutely, because I think that I like the idea of sort of taking it a step further. So we definitely developed this research agenda with the community. We developed this entire plan with the community. Nothing about us without us is a mantra that we really take seriously. But to get people actually living with spina bifida, doing the research and engaged in it in a much more direct way is really exciting to think about.
There's another question. You've mentioned life expectancy has increased. Is there a source we could read about these findings?
Yes, actually, that we can actually get that out to you. That research report that Epic research pulled together, it's available publicly on the web. And it's not behind a firewall or anything, so we can make sure that you all get that link. I was actually, I was just reading it actually. I'd seen it, but I was reading it in more detail earlier today.
What is the role of chapters, both affiliated and corporate, in the future of SBA as a whole?
The question is around the role of chapters.
Role of chapters.
Yeah, chapters are a huge part of our work. If you're a voluntary health agency, which by definition means that you are volunteer driven, you have to be connected to the communities where people live, and that's what chapters allow us to do. They allow us to have a connection and a deep connection to communities. And so oftentimes, first of all, chapters were a huge part of developing this plan. They were actually the first place we stopped in the development of this plan, because the people who are part of our chapters are closest to the ground. And at least what I have found in the 2 years that I've been here is that they have the best sense of the chapter leaders, along with Juanita, who runs our National Resource Center, I think have the best sense of the day-to-day challenges that people with spina bifida are facing. And so they oftentimes are an important part of making sure that the people's immediate needs are getting addressed. They're also very important in terms of rallying support. If we need to generate advocacy around an issue, we need to rally the troops, if you will. Chapters play a huge role in that. My hope is that, and really what we're trying to drive toward is, it's not that, we don't have a picture anywhere of what this will look like, because I think it will emerge organically as opportunities present themselves. But I really want to make sure that we get to a place where everybody in every part of the country has some connection to a chapter, or at least some kind of a field representative, so that they can have some sort of a connection that's closer to the ground. We know that we have, I believe, 9 affiliated chapters and 4 corporate chapters right now. But that leaves parts of the country that we try to support, but they don't necessarily have chapters. And I would like to get to a place where we have some sort of a field infrastructure that makes sure that there aren't any gaps in that coverage, because I just think that that field infrastructure, the chapters infrastructure, is really important to the work that we're doing. Again, you can't. We want to develop, and a big part of implementing this strategy is making sure that we're meeting people's, doing a much better job of meeting people's immediate needs, meeting the needs where they are, but also addressing the systemic challenges that people with spina bifida are facing. And I don't think that, at least from my experience, that you can, especially in terms of meeting people's immediate needs, you can't do that without a chapter infrastructure. And so it's very important.
Another question: does the Human Engineering Research Laboratory currently have any work it's doing with SBA?
So I can take that one. So the Human Engineering Research Laboratories is my laboratory. And certainly, yes, we definitely partner with SBA on a lot of what we do. Our research lab focuses on assistive technologies to improve the lives of people so that they can be more mobile and more independent. And one example of an area where we do a lot of work is mobile health. So we've developed a lot of mobile health technologies to help support self-management for people with spina bifida.
Does anyone else have any questions that they'd like to ask or put into the Q&A section?
I do see one comment, just referring back to the earlier question about adults with spina bifida being engaged in research. Someone pointed out that the mental health research group and the weight management research group have several active adults with spina bifida on them. So I do know that we try to include people, again, in developing the research. I think that's really important. I know I recognize, I see some friends in the chat, so I know some of you out there, and I know some of you know that previously in a prior life I worked for an organization that was very interested in helping nonprofits like places like the Spina Bifida Association develop their ability to be better connected to the communities they serve. And one of the things that was really nice when I first started working here was that I'd said to Sarah Struy, our CEO, if I'd been working at that place and had a conversation with Spina Bifida Association, I would have had to tell you that I didn't think you needed our help, because I think this organization it takes the making the community that it serves, putting them at the center of the work very, very seriously in everything that we do. It's really an ethos and part of the culture here.
Another question that popped up in the chat a little bit earlier on was, how can adults help in getting the word out there about the advocacy?
Yeah, that's exactly. I saw that too. It's exactly where I was going to go. So there's a number of ways. So one is that we're going to make this available. So if there are any organizations that you all are connected to, that you think would be interested in knowing what we're focused on over the next few years. And I say the next few years because if I'm being completely honest, we don't know how long this is going to take. We're going to move as quickly as we can. The more we can raise money, to be totally candid, the more we can raise money, the faster we can move, because we can develop more capacity to do this work. But regardless of how much money we raise, we're going to move down this path, and we're going to move as fast as we can. But anybody that's interested in that you think, any organization, any policymaker any local politician that that would be interested in hearing more about the work we're doing, I think that you should share this. I also, there's a number of other ways. One is that I think I'll put a plug in now for our annual Teal on the Hill event. The 2024 Teal on the Hill is going to take place February 25th through 27th. That's that Sunday through Tuesday, the last Sunday through Tuesday of February. We picked that time because it's right in the middle of the appropriations planning process. It's early enough in the process that we can have an impact on it. There's always a couple of issues that we look at and we try to push when we're talking with federal legislators and their staffs, members of Congress and their staff at this event. But the number one thing that we focus on is trying to get more funding for the CDC Spina Bifida program. Again, that is the only program. The National Institutes of Health, they do research into sort of what's causing Spina Bifida and so forth. But this is the only program, the only one in the entire federal government that's solely focused on improving the quality of life for the people who are actually living with Spina Bifida. And it only gets $7.5 million a year. We were able to get a $500,000 increase in funding a couple of years ago, but that's a rounding error in the federal budget. And I think it comes out, I did the math, I think it comes out to like $40-some a person who's living with Spina Bifida, roughly. It's ridiculous. It's great that we have the program, but the level of funding is ridiculous. And so we have been pushing for an increase in that funding. There's not even enough money to pay enough clinics to get all the clinics in to be able to deliver data to the spine. And that program not only funds that registry, but also provides grants to organizations like ours and others that are working on Spina Bifida, and they support the Spina Bifida clinics in other ways. And so that program absolutely needs more funding. And so anyone who can sign up for Teal on the Hill, I really encourage you to do that. If you've never done it before, there's a ton of people I see in the chat who are old hats at doing this. They'll tell you you can be nervous about it, but the truth is it's not a big deal. You're probably going to have a meeting online with a staff person. The staff person is probably going to be fresh out of college, and they're just there to listen to you. And if you're a constituent, they're going to really pay attention to what you have to say. And it's just an opportunity for you all to tell your stories and the challenges that you all have had, and talk about the clinics that you go to. talk about the importance of the Spina Bifida program. We do a couple of days of online training so that you get a chance to think about the story you want to tell, and we put you in groups, and so you get to meet your group and sort of plan your game plan out for these meetings. It's a fun way to meet other people with Spina Bifida and their families. So it's in addition to being really important for our policy agenda, it's fun. And it's just a chance to connect with other people. So I would definitely encourage you to do that. Also, we're going to be launching an advocacy newsletter at the beginning of the year. So I want to make sure that you all, if you're not signed up for our newsletters, definitely do that, because we're going to start rolling out information on a more regular basis. And included in that will be ways that you all can get involved. For example, and one way actually this month is that we're going to be putting out a letter next week that we really want people to send to their policymakers. It's Spina Bifida Awareness Month, and we're really we want to use this opportunity to remind policymakers on Capitol Hill that we're here, that we're paying attention to them, and that we need more funding for this program. So there's going to be news coming out about that next week, but we have an online system. So basically you'll be able to, it's really easy. You'll be able to go in, click a couple of buttons, and it will send a letter on your behalf to your members of Congress. And I've worked for a member of Congress, and I can tell you that down to the junk mail someone in that office reads every single letter that comes in. So someone who has jurisdiction over health policy will see that letter. It will get read, and it will get a response. And so it's not just busy work. It's really important that we keep the pressure on Congress. As dysfunctional as they might be right now, we need to keep the pressure on them, because they will eventually pass another appropriations bill. And every year, one of the reasons we have to go back and do this every year is because this is discretionary spending, and so it's not the $7.5 million is not set. At any given time, they could just decide to cut the program. And so not only are we asking for an increase in this program, we have to make sure that the program doesn't get cut. It's frustrating that we have to go back every year and do that, but we have to. I think you all are worth it. And so we're going to keep at it.
We had another question. What is SBA doing to better understand and address the causes or risks of premature mortality of adults with spina bifida?
I can take that one, Mike, if you like.
Yeah.
So I would say there's multiple things. One is advocating for research. So SBA has been partnering with CDC to carry out research in several different ways. There's several ongoing projects right now, actually looking at a literature synthesis of what we know about mortality. There's the study with the EPIC electronic medical record that Mike mentioned earlier that was just done. There's mortality data collected in the National Spina Bifida Patient Registry, and that's a current project to analyze and understand that data. I would say the second piece is the healthcare guidelines. So we're trying to address care to prevent the mortality from happening early. There are different aspects of the guidelines that are focused on prevention. And I think the one on sleep disordered breathing is particularly important to highlight, because it shows the importance of sleep apnea and how that needs to be detected and treated. And there's other aspects of the guidelines, of course, that are focused on prevention of things like skin breakdown and bladder infections, things that could turn into sepsis and lead to early mortality. And then finally, I would say advocacy. Unfortunately, the reasons for death that we know about, that are documented and that are in our databases, aren't collected very clearly. So a lot of times when people pass away, unfortunately, the reason for death is listed as spina bifida, which of course doesn't really make sense and isn't accurate. And so SBA is also working on advocacy efforts so that the reasons for documentation is better better carried out, and that we collect data that's more accurate, that then we can inform, future projects.
Yeah, just to add to that, I really think of this entire adult care initiative as being aimed toward addressing that issue, because and this is I'm speaking as a non-medical expert, but I don't think you have to be an expert to know that if adults can't get preventive care because their family doctor, because they had Medicaid, there's no spina bifida clinic for them to see, and they can't go to the one in the state next door, even though it's only an hour away, because their Medicaid won't cover it. And they can't go to their family doctor because their family doctor's never treated a person with spina bifida, and they call it spinal bifida, and they think it's a pediatric condition. And so they end up dealing with issues like sepsis and issues around neurogenic bowel or bladder, because they can't get their catheters covered by insurance. They can't get things like TAI, and they end up having to go to the emergency room for treatment. And then the person in the emergency room doesn't know how to treat them, which we've seen time and time again, and they don't know how to ask the right questions because they've never dealt with someone with spina bifida. It doesn't take an expert to see that all of those things are going to have an impact on your health. And when you're not getting the treatment that you need, it's going to have an impact on your lifespan. And so we have to, I think, if we're really going to improve those health outcomes, I mean, it's clear that we have, the research shows that we have, and I'm grateful for that. But the next evolution of our work has to be to build this healthcare infrastructure, to make sure that everyone in every state can access someone who actually knows how to treat adults with spina bifida, to make sure that insurance actually works for people, so that not only can you access it, but then when they start prescribing things like medical devices and prescriptions and things you need, that you can actually pay for them. But to Brad's point, making sure that we do the research and get the data we need, so that we can improve those guidelines that we created. They can be further informed by research and data, and we can continue to roll those out, so that we can raise the bar across the board for spina bifida care in this country. And it seems like a big mountain to climb. It is. But I'm absolutely, unlike maybe other medical challenges that exist in this country, I'm convinced that we can achieve all of these things if we work together, if we keep the pressure on, if we continue to generate and raise money to build the capacity that we need to do this. We can absolutely make it happen. I truly believe that we can. And we're not going to stop until we do. I'm sure I speak for everyone when I say that I'm tired of getting notices that my friends are dying prematurely. It's unacceptable. It's completely immoral. It shouldn't be happening in this country, and we're going to stop it.
So I want to say good night and thank you very much.
Thank you all. Appreciate the time.
Thank you, everyone. Have a good evening.